3.
Hello, welcome to the interactive radiology case study. Here I have Kevin, who is trying to become a vet assistant. So I'm just going to lecture him on how to take radiographs for this particular situation. So I'm going to present a common clinical case that's seen in a lot of emergency situations, and you are going to basically be the veterinary technician and decide what to do with the patient. So you're working at your regular job in the vet clinic, and suddenly, help, my cat Simone is not feeling himself and he's peeing all over the house. After speaking to the owner, you get a little more information and you find out that Simone is a 3-year-old male cat. He's up to date on all his vaccines and he has no previous medical history or issues. When you question the owner a little more about the urination, she mentioned that there is blood in the urine and he's peeing in very small amounts very frequently. So once you get the history and let the doctor know, the doctor goes ahead and does the exam, and he comes back out and he wants to perform diagnostic procedures. So what diagnostic procedures do you think the doctor would like to perform first? Considering the situation of your patient, what diagnostics do you think the doctor would like to do? A urinalysis or a fecal flow?
Probably urinalysis in this case.
So good job. The doctor first recommended a urinalysis, and we take Simone to the ultrasound in order to do an ultrasound guided cysto, which a cystocentesis is whenever you draw urine or any type of liquid material that's in the bladder.
Okay.
So upon ultrasonic evaluation, you note a foreign figure, as you can see here, with shadowing, so down here. And that's very common in bladder stones, is seeing that shadowing there. So the doctor requests that you take an x-ray to confirm if they are stones. You go to the x-ray room, put on your personal protective equipment, which includes a dysometer badge, lead apron, thyroid shield, and leaded gloves and goggles. What type of images should you take considering your patient's situation? I have thoracic and abdominal.
I think abdominal in this case.
So yes, considering your patient might have stones, it's best to take abdominal radiographs because the bladder is located in the abdominal area. So you insert the correct KVP up here and MA, and the company will usually have a list with what is correspondent to what type of body, part of the body that you're taking. And you begin to position your patient. So what's the gold standard for abdominal x-rays? 1 view or 3?
I would think a little more than 1, so I will go with 3.
Correct, 3 views, and that's because with 1 view, sometimes you get superimposition, so some things are overlapping and you can always see. So with more than 1 view, or in this case 3 for gold standard, you're able to see a lot more in different views. So you take 3 views of the abdomen positioning and position the patient correctly. So take a look at the 3D model of the cat provided to you and allow me to explain how to position the cat and where the view should be collimated. So collimation is whenever we close where we are taking the radiograph, so that way we can limit scatter radiation and it focuses on our focal point. Keep in mind you can use sedation or restraint tools because sometimes with cats, as you know, they become impatient. So you can use sandbags, tape, weighted gloves, but don't place any sandbags on the chest because you can cause respiratory distress. So for a right lateral view, you're going to have the right side of the patient. It's going to be laying on the surface or the table, and the left side will be facing up. A left lateral view would be the opposite. So the left side of the patient will be laying on the surface, and the right side will be facing up. For ventrodorsal, the patient will be laying on its back with its abdomen facing up. The collimations for abdominal x-rays are full peritoneal cavity, so you can count to the T4, which is the fourth thoracic, the rib, the fourth thoracic vertebrae, to the greater trochanter, which is going to be right here in between in the middle of the thigh, or where the femur is kind of located. And you also want to include the coxofemoral joint. So some tips is that you can always have someone that is also wearing personal protective equipment to help you position the patient. And it's best to extend the forelimbs away from the body, so the arms extended out and the back legs extended back. You can also use foam wedges to make sure there's no superimposition and make sure nothing is overlapping, and expose at maximum expiration. So once the patient has completely exhaled, go ahead and press the button in order to take your image. And you also want to make sure to add markers, so that way whoever's looking at the x-rays knows whether it's laying on a left side or right side and what side of the body is facing up. So we take our x-ray here, and note that the stone that was in the ultrasound is right here. And you can also see the size of the bladder, how big it is. That is not normal at all. So the cat seems to have some type of blockage. Maybe not completely, because as the owner said, there's a little bit of frequent urination, but very, very small amounts and a lot of blood. So, and there's also a stone here obstructing the urethra. And that's something we didn't see in the ultrasound. So as you can see, this radiograph was a great diagnostic tool. So you did it. You helped the doctor diagnose the patient. The x-rays were able to demonstrate the obstruction that was not seen in the ultrasound. And positioning, as you can see, is extremely important, because if we take a look back at this image, if these legs were a little bit higher, it would be obstructing the view of this stone here, or if they were a little more back, they would be obstructing this stone. So now that you know how to take abdominal x-rays, what do we do about the blocked cat? These stones must be removed. So the doctor will most likely want to surgically remove the stones and possibly place a urinary catheter. So that way Simone can urinate with more ease. But before performing any type of surgery, it's always important to run pre-surgical blood work. One of the biggest concerns for blocked cats is hyperkalemia. And hyperkalemia is a buildup of potassium in the bloodstream. And this can occur from the blockage, because without urinating, you're not able to eliminate all those toxins, and it's constantly building up in the blood. So high potassium levels can cause many issues, and it can also cause a lot of issues with the heart as well. So it's important to run blood work to ensure that the patient is stable to undergo the surgery. And if there is hyperkalemia, the doctor can choose different medications such as dextrose or calcium gluconate or insulin. So the surgery was a success, and Simone recovered quickly. The stones were sent to a lab and came back as strobites. Simone was put on a urinary diet to prevent the stones from forming again, so possibly like Hill's CD. So good job.
Thank you.